Good day, everyone. Welcome to the Secondary Podcast, the podcast that dissects different health topics to give you the way to have a proactive health lifestyle and to make sure to adjust accordingly to different diseases in our landscape today. And today's topic, we're going to focus specifically on prostate health, more specifically, benign prostatic hyperplasia. We're going to talk about what it is, what it affects, the organ it affects, the symptoms you should look out for, the treatment that you can go through, the investigations that you need to do so that you know whether you have this or not. This is Seco Direct, and I'm your host, Dr. Tiwa. Stay tuned for the episode. So, when it comes to prostate health, it is something that is not touched upon a lot of the times, but it is something that impacts men's health specifically. It's something that men should be looking out for when they grow older. Now, when we talk about prostate health, what are we talking about? We're talking about the organ called a prostate, which is under your bladder and produces what is called the seminal fluid. Now, for people, seminal fluid is that fluid that comes out during probably sexual excitation, for example. So that particular fluid is called the seminal fluid. Now, as you grow older, you undergo changes, and this prostate can also undergo changes like being increased. So when it increases and then impedes the neighboring organs, which specifically we're talking about the urethra that brings out urine, that's where we get benign prostatic hyperplasia. Now, segueing to BPH, that's what we're going to call it for the rest of this episode. BPH, it is broken down into benign prostate hyperplasia. Benign meaning it is not cancerous. Prostate meaning the organ itself, and hyperplasia meaning it's increased. And this is usually very common as men grow older. Specifically, 50% of men over 50 years old usually have this condition as they progress through their life. This is why you have to be very proactive in the management of this condition. Okay, now let's dive into the symptoms of BPH. What exactly should we look out for when we look at BPH? I've already spoken about once that prostate enlarges, it can cause an impediment or cause a blockage to the urethra that produces urine. So these symptoms that come out are usually referred to as lower urinary tract symptoms. And there's usually a moniker to go through what they are. So it's usually called wish riddle, which is weak stream. When you say weak stream, it means that when you're urinating, it comes out as drops. Incomplete voiding. Incomplete voiding means that whenever you urinate, you feel like you have not emptied your bladder completely. Strain urination, meaning that when you want to urinate, you have to force yourself or have the action of feeling like you are forcing yourself to urinate. Hesitancy. Hesitancy means that when you feel the need to urinate, you don't want to go to the toilet to urinate, as basically. Then we also have the feeling of urinary incontinence. What do we say by urinary incontinence? That means when you want to urinate or have the feeling of urinating, you already have urine in your body or coming out of you already. That's incontinence. You are not able to control when the urine comes out. And also pain when you are urinating, or pain after ejaculation also. And we also have your urine having an unusual color. That colored urine is also one thing you should look out for. If you are experiencing any of these symptoms, it is clear at times that you might feel like, okay, this is something extremely serious. But as is already stated in the name, it's benign. It's benign prostatic hyperplasia. It is something that can be managed effectively. If your symptoms, although there are symptoms of lower urinary tract infection that are similar to this, you have to understand that going to your healthcare provider to provide a proper diagnosis is essential. Now, we've spoken about the symptoms. Let's look at the risk factors. When we say risk factors, who are the people that are more likely to have these symptoms or to have benign prostatic hyperplasia? We have one, men that are aged 40 and older. If you have a family history of benign prostatic hyperplasia, you also are a risk factor to having BPH as a person. Medical conditions such as having obesity, heart or circulatory diseases, or type 2 diabetes, which already has urinary symptoms like increased urination, increased thirst, things like that. Lack of physical exercise. If you have a sedentary lifestyle where you are continuously sitting and not having to move around as much as people that have active lifestyles, you are also a risk factor. And finally, erectile dysfunction. What is erectile dysfunction? That is if you are unable to get your penis to stand on command of when you want it to work, especially if you want to urinate, for instance, you wouldn't get it to stand to urinate as effectively as it's meant to do. Now, we've spoken about the risk factors. What are the complications that can come about from having BPH? Now, BPH is when the prostate is enlarged, causing blockage in the urine coming out, like because it hits your urethra and makes the narrowing of your urethra smaller. So that causes the symptoms that we've already spoken about. So once you have those symptoms over time, what complications can arise? First of all, you would have what is called an acute urinary retention. Look at it as in this way of, if I'm unable to completely remove all the urine that from my bladder, won't that urine stay inside? Yes, they will stay inside because you're not effectively clearing out the urine out of your bladder. It means some urine stays inside. That is what we call acute urinary retention. You can always know this when you have a tense lower abdomen, because when you touch your lower abdomen, it's really tense because there is the force trying to force it out, but there's a counteracting force not letting the clearance go as properly as it's meant to do. Then we also have chronic and long-lasting urinary retention. This is when there might be even a complete blockage of your urethra where urine isn't coming out as effectively as it's meant to be. Then, if there is blockage and urine isn't coming out, there is what is called a backflow, which can cause bladder damage and kidney damage. And if there is urine that is stasis in your body, it is a site for infections to come. And those infections are usually called urinary tract infections. So those are the complications that you would have to look out for when we're speaking about BPH. Moving forward, what can we do, or when we go to our healthcare provider, what can we know to know whether we actually have BPH? So let's go to diagnosis. What is the first thing that we need to do when we go to our healthcare provider as to say, oh, these are the symptoms I'm having? The first and most gold standard of diagnosis for BPH is the prostate-specific antigen, a PSA blood test. Now, if it is increased, it is an indication of a prostate issue. There are different types of prostate issues, but it's an indication of BPH as well. You can also do a DRE, which is called the digital rectal examination. Now, a digital rectal examination is not a confirmatory test, but you would see that there's an impediment blocking the urethra just from examining through the rectal part. So what are the lifestyle changes that we need to do when we talk about, okay, we have the symptoms of BPH? First off, we have to reduce the number of liquids that we take before going to sleep or before going out in public. Avoid the drinking of caffeinated products or beverages or alcohol. Monitor the use of different medications that might cause these symptoms, for instance, decongestants, antidepressants, antihistamines. Train your bladder to hold more urine for longer periods. Pelvic floor exercises are usually very effective at training your bladder in terms of holding in urine. Preventing or treating constipation immediately it arises. That is also a way to make sure that your lifestyle changes are helpful in the management of the symptoms that you have for BPH. Now, going to the medications now. We have medications that help in patients that have like acute urinary retention, for instance. If it has not progressed into complication, we have medications that help the patient with their symptoms. Now, we have medications that help relax the prostate and bladder neck, making it easier to urinate. We also have medications that help reduce the size of the prostate by blocking the hormone that causes prostate growth. Moving forward, if these medications are not effective and the complications have already set in, then we have a surgical procedure that can help in BPH. And that surgical procedure is known as a TURP, which is a transurethral resection of the prostate or laser therapy. This can help reduce the size of the prostate and remove excess prostate tissue. Now, it is very paramount to understand that BPH is very common, especially with men above 40 years old. It's a very common condition, and it has been shown time and time again that it can be properly managed and effectively controlled. So if you have been diagnosed with BPH, you have to understand that it is something that is common, and you have to reach out to your healthcare provider to put you on the right treatment path so that you are able to handle it as effectively as possible, especially if people have adjoining conditions such as type 2 diabetes or hypertension that might make them feel that this has complicated the condition that they originally have. It's been known that this BPH can be contained and managed effectively. In conclusion, today's episode, we've gone through what BPH is, what the prostate gland is, what it does for the body, the symptoms to look out for, the complications that can arise, the risk factors, the people that are prone to having BPH, and the treatment management of BPH. In summary of all of this, we have to understand again that it's not the end of the world if you notice that you are straining to urinate, or if you notice that you are hesitant to go to the toilet to urinate. These symptoms can be conveniently managed and effectively controlled. And that brings us to the end of this episode of SecoDirect Podcast. I'm your host, Dr. Tiwa, and you have any comments, anything that you want to share with us, please leave it in the comments below. Subscribe and make sure to share this video with your friends and family members, because this is information that we are disseminating to you regarding these particular conditions and other conditions in subsequent videos. So thank you so much for being with us today, and I'll see you some other time. Thank you very much.